Hello, and thanks for joining us today on Lincoln Live. I'm Stan Lequin. I'm the VP of Digital Innovation, and I'm joined today by Megan Amdahl, who's our SVP of Operations. So much like all of you, a lot of us are working through, really how we ensure a safe return to places of business, and not only for our teammates, but also for our clients and customers. And so, Megan and I'll be sharing our experiences on how we've really, helped our teammates feel good about returning back into the office, how we've engaged with our clients and partners around their plans, and really kind of sharing what we've seen as kind of best practices. I represent the digital innovation team, as I said, and we have some incredible capabilities around just a variety of enabling and transformation technologies. But one of our superpowers is really around Internet of Things, or IoT. And so we built a platform that allows us to quickly integrate devices into a IoT type of use case. And so we had, as the pandemic hit, we integrated thermal cameras, optical cameras, contact tracing, hand sanitation, and a bunch of different IoT devices into our platform, which allowed us to engage with hundreds of clients around what their plans are, what they're doing from a technology perspective, what they're doing from a people and process perspective, and how we can help them on the technology side. But we've definitely learned a lot of lessons through those conversations. And what was really evident to us is some of the things that we're doing at Insight, and I'm really excited for Megan to share this because she drives a lot of this. We really see this as best in class. I'm really proud of Megan and her team, our HR legal teams, and really our entire organization, how we've responded to an unprecedented time. Based on our business, which Megan will get into, there was really no sort of stop and pause. As things hit, we had to really dynamically respond. And so with that, Megan, it'd be great. Maybe tell us a little bit about your role and maybe some of the early day planning around the virus and get things kicked off.
Hey, good morning. Thank you, Stan. Happy to be joining you today. So you're right. For my team, we had really a hybrid situation occurring, which is as the pandemic hit, we had to look at our teams and determine first what our biggest decision was: are we an essential business? Because we do have, as part of my organization, integration and distribution centers. And at those facilities, we are really working to enable getting the technology out to our clients. And as we examined it, as the pandemic was hitting, what we do for our clients is often, incredibly mission critical, but it was also at that time what we were doing for our clients was starting to provide them the technology that they needed to lead us through the pandemic. So we were seeing our healthcare companies coming to us for new needs. For instance, we had them coming and saying we, need overnight thousands of devices so we can set up mobile testing facilities. We had them coming to us and saying we have serious situations where our patients are in isolation and we need to get them iPads so that they can communicate with their family and their loved ones. We had schools coming to us saying we have so many children that we are trying to support from learning from home, and they don't have the technology at their house to be able to do that. So we were very rapidly responding to those situations. And at the same time, we were having to determine, are we going to be able to keep our facilities up and running? Because it was really state by state that shelter in place started to happen and, coming out with, are you an essential business? And so our first thing was really determining we were an essential business. Throughout all of this, though, we've been very focused on how we keep our teammates and their families safe. And so I think we did, very early on, what's become very standard protocol: the physical distancing, the masks, we did face shields, gloves, all of that for our teammates, deep cleaning, all of that type of protocol. But I also think we had a great opportunity where we started to partner with our digital innovation team and started implementing technologies that are really meaningful at this time. So we've adopted the thermal cameras within our facilities. So in a very non-invasive way, as our teammates start to come into the facilities, we're, taking their temperature, really being able to tell real time if there's a concern there. We've just been doing so much around looking with you guys to say a big issue for us is contact tracing. So looking to implement those type of technologies as well. But Stan, I guess from your perspective, what are you hearing from the clients that they're most worried about?
Yeah, I think there's a couple things, right? So there's no playbook. And so, being able to relay what we're doing as kind of best practice with our clients has been just super helpful. I think you guys have done an amazing job, as I had referenced, and taking the learnings we're getting back from our clients as well. And so it's been hundreds of calls with our
Yeah.
clients around what they're doing from a technology perspective. And you mentioned thermal cameras, right? So the ability to look at 30 people at a time as they enter a facility and then pick off, is there any deviation in temperature? Being able to map that back to the processes that get developed from an operations and HR perspective on how do we engage with someone that maybe has an elevated temperature. What is that path, and how do we handle those alerting and escalations associated with it? That's sort of the initial conversations we started to have, but then it progressed to, what are we doing around asking questions prior to the teammate leaving their home, right? And how does that connect into detection of symptoms, and then how do we sort of take that data back in a non-invasive way, as you had said, and give them recommendations of please head into the office, or we like to have you stay home today, and then how do we contact that teammate and have conversations around it? Social distancing, right? How do we use IoT devices like optical cameras to assure that we are maintaining social distancing? And when that's deviated, how do we alert on that, and then have a conversation with folks that are deviation against the social distancing things that we set up? Contact tracing, as you mentioned, is a big one, right? And so that gets into there's very specific laws around face detection and other areas, and so we have a tremendous partner ecosystem that we've worked with around these solutions and integrating into our platform. And then how do we create anonymous data to track folks through? And do we use mobile phones? Do we use bracelets? Do we use cards? Really working through all the scenarios. But I think one of the big things we've seen outside of the technology side is again, no playbook and really unprecedented, and the way people think about it, and how that's changed over really the start of it through where we are today. Initially it was for the next 3 months, for the next 6 months. Now people are starting to think, are we going to think about illness differently, right? And is this something we keep up forever? And then if we have a teammate who comes in who is sick after we move past this, do we have a conversation with them? Maybe work from home today. We've seen I think high levels of productivity in a work from home type of environment that we've been kind of forced to adopt. And so really just having conversations around their process procedures, some of the unknowns they haven't thought about. I mean, that's and then the enabling technology has really been the majority of what we've engaged around. So it's been pretty interesting. One of the things that one of our clients said to us was, when you do planning around supply chain and logistics, you plan around regions going down, you don't plan around the whole world going down. And so, you mentioned us being essential business, and some of the incredible things that we've done to enable healthcare workers and grocery stores and other businesses that are providing essential services. Can you talk a little bit about, I'm sure the supply chain component of it, and how we work with our partners, and understanding what they were doing, and how we controlled, how the supply chain component of it, and how our teammates participated, and percentage of folks that came back to the office. Can you walk us through that a little bit?
Yeah, I would say, one of the things that I think people have done that's been really important is we're all coming together as a community. So I have spent a lot of time with our partners, understanding what they were doing from a best practice perspective. We also had a lot of client engagement, a little bit more so early on, again, because of what we're providing for our clients and the critical nature of it. They went very deep with us really quickly to say, we want to understand how you're going to stay open and operational from a business continuity perspective. And I think some of the things that Insight did in this way is important, and it can relate to companies as they come back to the office as well. So a few things that we did that I think people should have the mindset and be thinking about is, we looked across our facilities that needed to stay open during the pandemic. And we said, one of the things that we can do that's really important is we can pull the density of the teammates out. So if you don't actually physically need to be in the building to do your job, even if it's a little bit more efficient for you to do so, we pulled them out and we had them working remote. This was actually really impactful. What we found was that some of our teammates that caught the virus early on, we had actually done that. We'd removed them from the facility. They were working from home, and it just kept our teammates that are there better able to physical distance and, just less exposure to people as they're getting their essential work done. So I think that was one thing that was really important. We shared that with our clients. We've shared that with our partners. But we also have split our facilities. So for our larger facilities, we've actually physically split them into two. We've moved leadership to be present on each side of the building. We really have leaders that, besides meeting in the parking lot to have physical distance meetings, don't see each other now throughout the days. And what we believe that provides us is, fortunately, Insight hasn't had a situation where there's, a broad outbreak within the facility. We've had a handful of teammates that have caught the virus across all of our facilities in North America. And we really believe, and they believe, that they caught it, from other essential workers that they're living with at home. And so we do think that the protocols that we put in place to allow the physical distancing, the masks, have proved really important. And I would say one thing that's different about Insight in our facilities than a lot of companies is we're receiving product in, it comes in, we receive it in daily, and then it quickly moves through our facility. So it is moving from one team to the next. We can receive things in, immediately bring it into our labs, and have our material handlers be putting it out for it to be staged for, asset tag imaging or even a complex server build, and then rapidly sent out that same day through our shipping department, onto our FedEx. So I do think, separating the facilities, just because that is a lot of movement. We're very focused on keeping everyone safe, has been important. Some of the other things that we've implemented is we took the mindset early on that a case will happen. And so we implemented protocol up front so that we could respond incredibly quickly when a case occurred. And so we'd already lined up the cleaning companies to come in that were going to stand ready to do, deep physical deep cleanings on our behalf. We already had the communication pre-written to our teammates. Obviously, we had to look at it and make some adjustments, but we also had the contact information. So, some of our facilities has 400, 450 people in it. We already had all of their cell phones, so we could rapidly send them the communication and inform them really very much real time what was happening, how we were responding to it, how we were ensuring the safety for them and their loved ones. And I think all of that just makes an incredible difference because teammates feel like they're being informed as quickly as possible. Through the communication, and just, we took time to think, what all will they want to know? What should we be providing in terms of information and clarity? And I think all of that has just led them to feel safe coming in. Some of the emails that I get that are calls from teammates that are the most important to me is they feel the genuine care and thought that we're putting into every day into making sure we're giving them the safest place to work. And so, we just continue the partnership with your team as you guys develop new solutions. We are rapidly testing and implementing and providing you guys feedback. And it's a strong partnership, and, it just gives our teammates and their loved ones a lot of confidence. And unfortunately, we're hearing a lot about other companies that aren't doing these things. And that's impactful. And so I would say that, when we have had cases happen, our return to work, the number of teammates that are comfortable coming back when we say it's time, we're ready, our return to work rate has been very, very high. And I think it's because of, they can just feel the care and the thought that we're putting into it every day.
Yeah, I know. I definitely feel it in all the communications and how we engage, and what I see from our team and the type of engagement. And so we've gotten to participate on some of the cross-functional team calls that you guys are leading. And can you talk a little bit about really, I don't know if we call it a task force, but what that cross-functional team is, how often you meet, kind
Yeah.
of what are best practices around communication, both as a team and planning, and then how we push that communication out.
Yeah, absolutely. So one of the things that we realized early on was that we weren't having to just be focused on our teammate potentially not feeling well or being sick, but what if someone that they lived with or were in close contact with came down with a virus, or just thought they could have been in contact with somebody with the virus. And so we started a task force where we meet every morning early to go through and say, here's the status of teammates, situations that they have at their home that we're monitoring. And what we do through that is we really figure out, based on this teammate specific situation, how long should we have them stay remote? And we really decide when it'll be a safe time for them to return back. Through that, we've continued to develop questionnaires that we have with the teammates, and definitely taking the mindset that collectively we're all of us are smarter than any single one of us. And because this is such unprecedented times, I truly believe that if we hadn't brought that team together, and if we didn't have the calls daily, that we would not be in the situation that we're in, where our teammates are very safe and we've been able to stay up and operational. So the team that we have coming together on it is my site leaders for the sites that need to stay open. We also have on HR personnel that supports those sites. And then we have an individual from our legal team. And we think that's really important too, because he does spend a fair amount of his time right now reading publications and recommendations from our health organizations, as well as state specific guidelines. Because as we know, a lot of this is being done city by city, state by state. There's travel restrictions now. And so the team that rolls up to me isn't, just these integration and distribution teams. The operations team at Insight is actually quite broad. So in the middle of this, we're also trying to integrate a company that we acquired last year, and that does require travel. Teammates going on site to help with training, data migration, and things like that. And so we're being very careful with how we implement travel with them, what additional safety protocols, what state-specific rules regarding travel and quarantine time we need to be considerate of. So I really recommend that, if a company, as they look to reopen, having that cadence has been really meaningful for us.
Yeah, it's incredible. I know we definitely feel it in other parts of the organization on how you guys are communicating, how you're letting us know how we should be engaging with our clients, and so definitely appreciate all the work of the team there. One of the things that you mentioned was an essential business, and our back to work percentage being so high. I definitely feel it in the stories that I take so much pride in, and how we're
Mhm.
supporting essential workers. Can you walk through a little bit about what that communication's been, and how we celebrate just the amazing things our teammates are doing? Because I think it's so critical, to have that understanding of purpose, and how we're supporting those that are on the front line.
Yeah, and I do think it's really important, Stan. I think especially Insights not working in a hybrid environment. So, some companies have the situation where their entire workforce was able to go and work remote, and then others are operating either fully still on site, but we're split. And so, for our teammates that had to continue to go in to do their essential work, one of the things was, from a leadership team, we felt it was really important to make sure that we were messaging more than ever the purpose behind the work that they're doing. And so our sales organization has done a really great job of providing us feedback on a regular basis of things that they're hearing from our clients, and how impactful it was. And I could probably get choked up telling this story, but we had teammates that really worked the weekend, worked extensive overtime so that we could deploy for one of our healthcare companies iPads, and we worked really closely with our services team so that we could train the nurses and stuff very real time on how to use the iPads and the teleconferencing technology that we loaded to it so that they could bring it in to patients that were in isolation to talk to their loved ones. And we heard about, you guys got that to us just in time. This person that was actually dying was able to talk to a broad cross section of his family and his loved ones and be able to say his last words. And if, we hadn't been able to source it that quickly, deploy it that quickly, and train up the healthcare teams on it, that wouldn't have happened. And so we do take the time to really talk our teammates through just how important it is, the work that they're doing. And it makes a big difference because, all of these teammates that continue to go out there and be essential workers, they were scared too. They're thinking about their family and their loved ones. And so we spend a lot of time hearing directly from them. I hold roundtables, and they're different than they used to be. People are calling in from across the facilities on their cell phones. But I'm wanting to hear, from the teammates on the floor, what more could we do? What do you think would be a better practice? And we evaluate it very quickly, and we implement and we make the changes. So I would just say, it's definitely a time where people need to understand just how significant their contributions are. One of the things that Insight did that the teammates really valued was we had teammates write handwritten notes to our individuals working in our integration and distribution centers, and we scan them onto banners, and they hang in our facilities now. That one was really meaningful. We also did a GoFundMe where from employees working at Insight, we raised money so that we could send all of them a personal thank you note and a gift card to a store that we thought they would all enjoy shopping from. So just saying and acknowledging, like, we know you guys are out there on the front lines for us, and we absolutely value you and appreciate you, has been really impactful.
Yeah, it's incredible, and it's hard to not feel an emotional connection to those types of stories, and just such pride in being a small part of such an incredible organization and everything your team's doing. So thank you so much for sharing that, Megan. We have I think we've done an incredible job of, and your team has been incredible in leveraging the technologies we're bringing to market with our clients. And we had to move really quickly around integrating these solutions into our connected platform. And so having all the components there was great and allowed us to quickly get thermal cameras, optical cameras, and other devices communicating and pulling the telemetry information or the really important data off of that, and then turning it into our powerful workflows. We could take the right alerts associated with it. So I know we're using thermal cameras today. I know we're going to be using optical cameras for initially people counting, and then using machine learning models to do face mask detection and social distancing. So really appreciate the support as we continue to roll that out to our clients as well as internally. I know one of the really important things for us is contact tracing. Can you sort of speak through a little bit about kind of what that is today? And I know you're going to be piloting actually 3 different solutions that we're going to market with. So thank you so much for doing that. But can you talk a little bit about the teammates' comfort level and the type of solution we're deploying, how you've been communicating those solutions out, how you've been soliciting their feedback, and then maybe a little bit about how you think about contact tracing?
Yeah, so the thermal camera one was probably the easiest to roll out, again, because it's just so non-invasive. It's up on a wall and teammates walk by and we're scanning them. And we have a protocol that we worked on with HR and legal if we do get an elevated temperature, how we handle it. And I think that's a very smooth process. So that's been going well. The other thing that we implemented was a questionnaire that teammates download an app onto their phone, and they answer a series of questions, and those questions, really get at kind of the health at their home, how they're feeling that day, so that if there's anything concerning there, that we can have a communication with them before they come into the facilities for the day, and that's gone well. One of the things that's great is just the collaboration. So there's things that we have to consider. There's some, language barriers that we've had to work through with your team, but we've been able to do that. And then the one that we're working to implement, which is really important to me and my team, is that, as I mentioned, we've had a handful of cases across our facilities in the US. And when that occurs, we really want to know how close were they in contact to other employees. And the way that we've been doing that is via video camera surveillance footage. And it's very inefficient to do. It's incredibly time consuming. And obviously there are spots within our facility where we can't see that. And so we're really excited to implement this technology, because what it's going to tell us is, using bracelets, using apps that are downloaded for a teammate that we're concerned about that they could have been exposed to the virus, or they actually are diagnosed with the virus, who they've come into contact with, for how long, how sustained was it. And that's just going to be so meaningful, because again, very time consuming today for us to review that video footage when this happens, because you're not looking at a single day. Obviously, you're looking weeks back in time to really assess, if we have an issue that they were within 6 feet for a sustained period of time. So we're really excited to get that technology in place. And again, most companies are not going to have very much in terms of video surveillance at all. So without this, it would be a real blind spot for companies. And I think, Stan, you could probably describe it a little bit better than me, but we're going to try multiple different types of technologies so that we can test and learn and give you guys feedback for what type of technology works best in our environment. And I think the good thing that we're doing is we're testing it in our largest facilities as well as our smaller facilities that are open, so that we can say, that the app seems to work best in our larger facilities, or the bracelets do. And then there's price point differences too, right? And so as we're looking at that and evaluated it with your team, it's like, what price point do we think is reasonable, and knowing that some of these things can get broken, lost, teammates might not return to work, and you've lost the technology device. And so we're working through all of that, because we don't see this as something that's going to be done here in a few months. We really do see this in some capacity as our new normal, and we just want to make sure that we make a good short-term and a long-term plan for how we continue to keep our teammates as safe and healthy as possible.
Yeah, I think, the first thing I definitely want to call out is the fact that we do that due diligence from a video perspective. And so I'm sure everyone who's tuning in can imagine going through that much video to try to protect all of our teammates, right? So that's absolutely incredible. From a contact tracing perspective, I think there's a couple technical things that are important. The first one is you can do it with cameras, but that requires facial recognition, and that becomes kind of tricky.
Yeah.
Phones and apps on phones can be a little tricky too, because now you're installing something on someone's personal device, possibly. And so that, I think, is tricky. Really what we're hearing the most of is a wearable, like you mentioned, bracelets. And then another one is cards. And all the solutions do the same thing, including the phone solutions, is where they set you up as an ID. And so rather than being Megan Amdahl or Stan Lequin, you might be 1245, I might be 9787, and keeps our ID securely into a database. And then using Bluetooth technology or near field tracks our movements as relates to how close are we to the other devices, not our movements around us, just a facility from a GPS perspective or anything like. It's not that type of tracking. It's really that contact tracing. When you get within 6 feet, those two devices communicate with each other. And there's a lot of things you can do there, right? So you can sound an alarm to instantly sort of warn. You can pop a notification. You can vibrate a badge, those types of things. And all the solutions we're leveraging has a combination of those different sort of escalations. But the contact tracing component, I think, is really critical. And we've seen, like you mentioned, devices that are from a couple, $10 to $100, and there's different use cases around battery life and recharging, and So that factors into it. I think another one is
That's
just
true.
the overall acceptance of it. And so I
Mhm.
believe our plan is to do an opt-in plan. Is
Mhm.
that okay? And
Well, for the pilot.
for the pilot,
Yeah,
yeah,
but what we are trying to do is once we determine that a technology is sound, we do go for full scale adoption. One of the things that you just mentioned, Stan, that I think is really important, especially for people, that are going to be returning back to the office, is if they're wearing a wearable that actually vibrates when they come into contact with someone too closely, that's huge because I know that our teammates in our facilities, it's something that we've had to continuously focus on every day. And people, as time goes on, you can start to get a little complacent. And so it's just so important. But as I see people coming back to work, that's 6 feet. 6 feet's far, And so I think that shaking reminder or a light going off, that could be really invaluable. I was just at a park last night watching the kids play, and I was like, "Hey, everybody, let's back up a little bit," And so I can definitely see that being an issue as people come back to work. So when I was talking with your team about which ones we wanted to pilot, the ones that vibrate or do the lights, I thought would be a huge help for us.
yeah, and maybe what might be helpful is I can describe kind of what ideal would be for an
Yeah.
organization, and I think we're doing a lot of these from a technology perspective, and so the first part is the questionnaire, and so it starts
Mhm.
there. And so we have a variety of solutions that we've rolled out, from a simple mobile application to chatbots that hook into CDC, World Health Organization, that type of thing, and dynamically update. Contactless is a huge component to everything that we're seeing and
Mhm.
everything we're doing. And so in some of the chatbot scenarios that we're implementing, it's all voice based. And so you can ask questions. And so we want to avoid that touch. When the touch happens, a lot is be done with UV to
Mhm.
sanitize whatever that device is if touch is required, but really trying to move away from that.
Mhm.
Then it moves into moving into a space, and typically that is thermal imaging. Lowest common denominator there is doing the handheld, contactless. Obviously, 6 feet becomes a challenge there. And we do have clients initially started that way, are outsourcing to healthcare organizations that are coming and helping them with that component. What we're doing in our facility is we are using thermal imaging cameras that can do up to 30 people at a time as they enter into a space. We're doing that in our large facilities. In our small facilities, we're doing a kiosk approach, and so that's you walk up and it gives you the red green based on your temperature, and then permits you in. I think one of the really important things is to, as Megan mentioned, you have those policies in place. They are very individual to an organization, and so having a workflow that allows you to handle the enforcement of that is really critical. And I think that's one of the big benefits to the application we have, is not only the single pane of glass and pulling everything together, but it's allowing you to handle that workflow and escalation associated with it. So after you enter the facility, you've done the questionnaire, we've done thermal imaging. Then it's really about, from a prevention perspective, social distancing, doing things like people counting to make sure we're not having too many people in one specific area. I'm sure a lot of our folks that are listening in today are going through office planning and percentage of people, and how they have to change physical facilities. And so having that data of density and people counting and how many people in a specific area becomes really critical. Next, that moves up to social distancing, which can be done through a variety of different mechanisms. And so we've used smart devices that we put in an area that handles that component of it. We've used sensors that set off an alert if it's being a social distancing is not being adhered to, and we also use optical cameras that can use machine learning models to say, are you within 6 feet, or opposite of that. As Megan said, anything you do to give that immediate sort of feedback, because people kind of have to learn, really kind of, what 6 feet means, and you don't think about it. And so I know that's constantly something in the early days of this, all of us are working through, probably around hand sanitation and everything else. And we've changed a lot of habits over time through this. that has to happen around social distancing as well. And so that kind of is the next area. And then contact tracing is a big part of it. And then we're also doing a lot around hand sanitation, leveraging, those types of RFIDs or other badges that come in contact when you enter an area, or using hand sanitizer as you exit areas. There's a lot we're doing with that with our partners as well. And so that becomes a big part of the prevention moving forward. And so, that's really kind of the ideal scenario we're seeing with clients that are really forward thinking about this, is it's going through each one of those steps and leveraging technologies, as well as just some incredible people and processes that are built on how to leverage the technology, how to respond when there's an issue, and developing those protocols.
Yeah, I think one thing that, as we were working with your team to adopt, is the great thing about the thermal cameras versus how a lot of other companies might be doing it, checking temperature by temperature, is one, you don't have anyone that needs to get in that close of contact, which is, I think, really important. But you can do so many people at a time, as you're mentioning. Some of the cameras can handle up to 30 individuals at a time, and that's really important, because you don't want, as people come in for their shift, or people just tend to start their days at about the same time. You don't want everyone congregating to get temperatures text, or to complete an app at a kiosk or a form. So I do think you guys have done a really great job about thinking through the actual, as we implement the technology, will that really work based on how businesses perform? And that's what I think is kind of a true differentiator. And so I think the partnership that our two teams have, which is, testing, learning, every now and again we come across, oh, I didn't think of that, but we can adjust real time, and we just think a lot ahead for what our clients are going to be needing, for what our communities are going to be needing. And so it's been really important, I think, and you guys are doing amazing work, and excited to see what we continue to do together to keep our communities and our teammates safe.
Thanks, Megan. Really appreciate it. And I think one other area that I didn't mention is, as we're showing alerts, we're not doing any facial recognition. We're not keeping any data that violates any regulations. So our legal teams, our clients, have been pretty incredible in helping us shape that solution, as well as your team. And so really it's just the elevated temperature, the picture of the teammate that has the elevated temperature. So we can then go have a conversation around, whatever that specific protocol is associated with that. So it's been, in a small part, we've just been appreciative of being a part of the journey we've gone through, and what we can do to protect our teammates as well as our clients. As you mentioned, unprecedented times. Really want to thank everyone who joined today and spent time with us. Was excited to walk through what we're doing. Hard to get too excited based on the subject matter that we're talking about, but was happy to share what we're seeing, some of the best practices that we're running into as we kind of go through this journey together. There's a link that'll get posted on the products we have and the solutions we sell. We've had just a tremendous opportunity to just engage a really incredible partner ecosystem that we've integrated into our solutions, as well as we've become kind of experts at this at a necessity based on the hundreds of conversations we've had and the work we've done internally. And so we're happy to engage in any way possible to help you as you kind of work through your reentry plans. So thanks again. Really appreciate it, Megan. Can't thank you enough for sharing and being a part of the call today.
Yeah, absolutely. Thank you, Stan. Have a good day, everyone.
Thanks. Bye.